Hello there guys, Brandon here for you and thank you for watching my first video on ear acupuncture. I'm not gonna go into too much details about the whole theory and philosophy of ear acupuncture and the history of it. If you are interested in this subject, you're more than welcome to make your own research and read some really good books about it. It's very interesting, but it would just take ages and way too long to explain everything. And so I'm just gonna jump straight to standard names, location, indication, and meanings associated with ear points and areas. And today we are going to talk about the helix part of the ear and the different points that are on the helix of the ear. So here we go with the ear helix point. The helix starts here and goes all the way around your hair like that to the tip of your lobe, your earlobe. Okay, we're gonna start by this point really at the helix root, so we call the helix root, and it's called the ear center. Okay, right there the helix root, and it is a point extremely good for hiccups, vomiting, heartburns, due to spasm of the diaphragm. So it's a point that is directly related to the diaphragm. Very good for those conditions, and it is also a master point. In ear acupuncture there are over 10 master points, and this one is called the point 0. The point 0 is a very good point for as a general support of any other acupuncture points you might use, and also as a regulation of balance and homeostasis in the body. Pretty much all the time I use the point 0 point for any acupuncture treatment that I might give, as I find it very effective in relaxing the patient, and also offering general support to other acupuncture treatment, and also offering a general balance and homeostasis, as I just said. It's a very powerful point. Although be careful, don't needle too far, very needle superficially, because it's a quite sensitive spot right here and quite painful for the patient. Going up again, right above the supratracheal notch, which is a little crest above your tragus. Okay, you got a notch right here called the supratracheal notch. Okay, right above it, you take the center of the supratracheal notch, and right above it, leveled with the large intestine, which we're gonna see later, we have the rectum. Right there, supratracheal notch right here, right above it, a few millimeters above it, we have the rectum point. As the name says, of course, prolapse of the rectum, constipation, diarrhea. Yeah, I mean, that's pretty much it for the rectum. I mean, hemorrhoids, it's very good for hemorrhoids also. Any kind of like lower digestive problems, and it is very effective. Right above the rectum, right there, so we have the rectum point. We have level with the bladder point, which we'll see later on also. We have right above it still, so you just follow the center of the supratracheal notch, rectum, and right above it you got urethra. Urethra point, as the name says, also frequent, urgent, painful urination, and also frequent urination at night. It can be used sometimes also for prostatitis. Some people say it's actually effective. He also offers a great support for prostatitis and also retention of urine. Now we go up a little bit at the helix, really like going up the helix right here, level with the sympathetic part, which we're gonna see a little bit later. But for now, we are going on the helix, leveled with the sympathetic. So that little protuberance here on your ears, okay, right underneath the triangular fossa, okay, you take this line right there, you keep on going, and you are on the helix, and once you are in the middle of the helix, you just needle right there, so that's really leveled with your sympathetic point, okay, and with this little protuberance right here, so you level here, and right in the middle of the helix, we have the external genitalia, external genitals. This is very good point for any kind of like after surgery recovery of genitals. Also for eczema of the scrotum, herpes, genital herpes, swelling and discomfort of the genitals, very important, and excellent for fallopian tubes also. Going up, we have the triangular fossa right here, and we have this superior triangular fossa, okay, which is the far end, superior far end, and we're very close, the closest part of the helix, okay, on the superior part of the triangular fossa. We just level it right there, and we have the anus. Anus, as it says, we tend to needle the anus and the rectum together for maximum therapeutic effect. But of course, hemorrhoid, prolapse of the rectum, and any form of lower digestive tract infection and bacterial infection, viral or whatever, are also very good for diarrhea and constipation. Alright, follow me so far. So we got ear center, urethra, sorry, ear center, rectum, urethra, external genitalia, and anus. So far, that's what we got. Now we're going up, and we're going on the tip of your ear, right there. Very the tip of your ear. You know, the tip of your ear right here. It's called the ear apex. Ear apex. Extremely good point for fever, and extremely good point for hypertension. Also, you combine this point with kidney 1. It does wonders. It's absolutely amazing. Absolutely amazing. Headache, dizziness, eye disorders, and also eczema, and any form of allergic conditions. Really good, powerful point for allergic conditions also. Right underneath it, we got this little tubercle, which is right there. It's called the Darwin tubercle. It's called also the helix tubercle, the Darwin tubercle. Many people have it. Some people don't have it, but most of the time you will meet in people. It's you see it always. It's a very good point for headaches, dizziness, and also acute and chronic hepatitis, okay, and vision problem, okay, because this point right here is called liver young, and it's a point that is directly connected and related with liver condition in Western and traditional Chinese medicine diagnosis, okay. So on the helix tubercle right there, Darwin tubercle, you needle perpendicular to it. Extremely good for those conditions. Extremely good for any condition that is related to liver in Western and traditional Chinese medicine diagnosis. Okay, and to finish now, we have a combination of 6 points. 6 points called the helix 1 to 6 that you will needle laterally to the helix. So really on the sides of it, in the middle, on the sides of the helix. Okay, like that. Okay, and it's a combination of 6 different points, and that starts with helix 1 starts at the base of the Darwin tubercle and goes all the way down. Okay, so about, I would say, a little bit less than a centimeter separate apart from each other. 6 points going all the way down to the tip of the helix at the tip of the ear lobe, right there, just like that, just like this. Okay, helix 1, helix 2, helix 3, helix 4, helix 5, and helix 6. Extremely powerful point for tonsillitis. Absolutely amazing. And any form of upper respiratory tract infections, sore throat, and also fever and headache. And also some people say for toothache, it can be very, very effective for toothache, combined with ear apex right here. So yeah, you can always combine it with ear apex. Usually I always add ear apex every time I use those points. Helix 1 to 6, I use ear apex with it. It just complements the therapeutic effect of this combination of points right here. Alright, so that's it for the helix points right now, my friends, and I hope you enjoyed it, and I will see you again very soon with other points, and this time we're gonna go on the antatragus points, which are my favorite point, all related pretty much with the brain. Alright, thank you very much for watching, and I hope you all like it, and please leave a comment or leave a little like. Don't be too harsh on the comments, please. It's my first video, I'm trying to do my best, but I will improve with time. Thank you very much, guys, and I'll see you soon again. Bye bye.